I'm gonna count myself as a viewer.
How do I?
Oh, you have to tell me when we're live.
Yeah, we're live. That's
oh,
good.
hey guys.
Yeah, perfect. All right. So how do you find it
there we
again?
go.
Oh, yay! Wait, that's not me live. It's kind of
There
live.
should be a delay. Oh, yeah, okay. Oh, good, there is a delay.
All right.
Where do you see comments at?
I don't know.
They'll pop up when they're.
When people like.
Yeah.
Turn in. Oh, that's awesome. Okay.
Comments are on. Yeah.
Wild.
Wild, you are wild. Pick a number between 1 and 5.
5.
Oh my god.
Always been high.
What is your preferred pronoun?
Oh, that's a really interesting question.
Mm-hmm.
I'm not a really person that subscribes to pronouns. I think that anything that you call me that's respectful, like I'm good. Hey girl, hey bitch, excuse me sir, excuse me ma'am. You over there, whatever it is, as long as it's respectful, I think that I'm pretty open to it. I feel like I kind of live in a vacuum of a lot of queer culture, and I know that I can understand why some people are very hard pronoun and some people are very lax. I'm one of those lax people. Definitely will respect anybody's pronouns that they want me to call them. I am human, and I do live in a vacuum of a lot of queer, I guess, gay men, where we call each other her, girl, she, things like that. So I try to be cognizant of people that don't prefer those pronouns. But if I do mess up, it's just because I love you and I'm addressing you, not because I have any ill will or mean, malicious intent.
Nice. Myself, my pronouns, I like he, him, his, but I also follow the same, I guess, thought process in regards to gay culture. Everybody is like, she, hey girl, you know, I answer to the same thing. And then also, if I misgender somebody, I always try to apologize and then say, well, what do you prefer? Because I don't know, especially if I don't know you, or if you're newly transitioning, or you've identified how you want to be, how you want to represent yourself, or the pronouns that you want to go by, and they're different than how you present, then I definitely need to know that. So I will make mistakes, and I have made mistakes, but I always just let the person know, like, hey, I'm really sorry about that, I didn't know, can you tell me what it is so I can fix that? And then after that, you're good to go. You know, I mean, you may make the mistake again, but the more important thing is to make sure that you're conscious of the words that you're using and the impact that they have on others. So that's why,
sure.
you know, that's like, especially for our trans brothers and sisters, it's important to know that, you know, that you're there for them and that you're willing to learn and grow as a person. So Ace and I are here today. We're going to be talking about health and sex and how COVID-19 has impacted that from where we were to where we are right now, and what we might be like, you know, in the future days to come, weeks, months, years, who knows. So with that, I'm going to give a little introduction. My name is Wes. I'm with KC Care. I'm a prevention specialist. So I do HIV, Hep C testing out in the community. I also do healthy sex workshops. And now we're doing Facebook Live, so that's super exciting. So I have Ace with me. Ace, if you want to give an intro about yourself.
Hi, I'm Ace. I'm the GM of Woody's Kansas City at 3740 Broadway in Midtown. It is a queer safe space, bar, fun, lounge, party, exciting place. Everyone is welcome. Everybody is included. What else is I supposed to say?
Oh, that's it. Just a little info about yourself.
That's it.
So I thought we'd touch first on the fact that, like, I'm wearing a mask and Ace is not wearing a mask. That's pretty obvious if you didn't notice. So, oh, that was syphilis.
It's alright.
So,
She'll come back.
Noted. So, Ace, can you talk a little bit about maybe why you're not wearing a mask and what that means for you?
I'm not wearing a mask because I feel like that I'm in a relatively safer space. I'm not symptomatic for any kind of bacterial infection. I feel like a good bill of health. I'm not in proximity to anyone that I know to have any kind of illness. And I don't really like my face covered. I feel like I'm really beautiful. But I do have a protective mask just in case I wander outside, step out to the patio, have to go next door and grab something, or if I ever feel unsafe for a moment.
Nice. So I'd add too that I'm wearing a mask because I wasn't 100% sure, so we're going to have that conversation about, are you practicing social distancing? Have you been wearing a mask out in public, and taking measures to protect yourself and others? And so now that we've had that conversation, just like when you engage in sex, you're going to talk to the person about where they get tested, how often they get tested, are they on PrEP, have they even heard about PrEP, things like that, which if you haven't, we'll cover that. So knowing that information and feeling comfortable in the environment, knowing that this person is taking safe measures to protect themselves, we're practicing our social distancing. So here, I feel comfortable, like taking off my mask and having a conversation with this individual. And it's the same thing as when you're engaging in sexual acts. You want to make sure that you have that conversation, you feel comfortable and confident in asking that person, do you get tested regularly? So when you guys, if you missed us when we first joined, we were playing a dice game, and one of the questions was, where do you get tested? So we had already covered that part of the conversation. So I feel really confident and comfortable with this person. And if we were to engage in sex, now's where, mask condoms, where you kind of have that CDC guidelines and rules, and suggestions on what you should do to be safer. So if you're engaging in safer sex, CDC recommends that you wear a condom. Right now, the CDC recommends that you wear a mask. Like if you're doing events where you need to go to the grocery store, or you're going out in public where you may be around people, you want to make sure that you're practicing, safe measures. So why are we more acclimated to wear a mask than we are to wear a condom? Why is that easier to put the mask on to protect ourselves and others? Or we're not doing the same thing when it comes to sex, as far as like making sure you're wearing a condom when you should be. If you're engaging in sex with a person that you don't know that well, that maybe doesn't get tested often, it's an anonymous hookup, something like that, you definitely should be wearing a condom during those situations. But Ace, why do you think there's that difference between the two when people feel more comfortable putting the mask on and wearing the mask as opposed to a condom?
I think part of it might be just because everything is so new, and I think that maybe with all the sexual health education that's happened in the past 5 to 10, 15 years, that and I mean even the leaps and bounds that we've made with medication, treatment, things like that, that people might feel a little bit more lax about their sexual health, as opposed to when we COVID right now, we don't really know a whole lot of how the incubation period, how things spread exactly. So I think people are trying to take a little bit more bigger safety precautions to figure out why before they contract anything.
Yeah, and I think knowing, that maybe the person's on PrEP, so they're getting tested regularly. They said that they're on PrEP, So for those of you who don't know, PrEP is pre-exposure prophylaxis. So that's a daily pill that you can take to protect yourself contracting HIV. So here you can see the little blue pill. You can also Google PrEP and it'll pop up. Ways to access Ready Set PrEP is a good one. Google that for uninsured individuals to access the medication. So for people who take PrEP, they're able to protect themselves from contracting HIV. Now, it does not protect you from all the other STDs, as you can see our little plushies here that are hanging around. So if you are engaging in sex with somebody who is on PrEP, but maybe they need education on what U equals U means. So U equals U is undetectable equals untransmittable. So if you are HIV positive, you're adhering to your medication, you reach a level where you cannot transmit the virus anymore, so it's called undetectable. So once you're at that level, it's really important to know that if you're engaging in sex with somebody who is on PrEP, and you've both been tested regularly, you're not having like multiple sex partners, then you can feel really comfortable and safe and confident knowing that you can have unprotected sex with this individual because you've engaged in that conversation. You've talked about biomedical interventions like PrEP and U equals U. And that makes a difference in knowing that information, where to access that, how to help that person get that information. Google's a great resource, kccare.org, KC Health Department, all of these places, Thrive Health can help you access that medication and testing services that you may need to protect yourself and stay safe. So, do we have any questions from any of our viewers, anybody who's watching? I don't, yeah, I have no idea if it pops up in here. So, there's, so DC Public Health issued guidelines on how to engage in safer sex during COVID-19. And so I imagine these guidelines are if maybe you're locked in the same apartment building, but maybe the same, not same apartment? I don't know how they have it set up.
I feel like they would just be abstinence at this point, right?
Right, yeah.
Unless you're with like somebody that you're...
Maybe you and your groupmate are like, you know what, let's just, we've been here long enough, let's just go ahead. I don't know. Because some of their options that they give are to, if you live with a partner, check in first and make sure you're both feeling well before sex. I hope you would know if you're living with a partner, if they're feeling good or not. And also if they're sexually active, like if they want to engage in sex with you, I would hope that that would be clear.
Yeah, I mean, consent is still sexy, if not even more relevant than ever.
Right? You can be, that really ups the text sexting. Yeah.
Oh, yeah.
I'm in the kitchen, come here.
I'm in the kitchen, check out my OnlyFans.
So it says, kissing can pass COVID-19. Consider not kissing anyone you do not know or who you are not sure has been isolated for 14 days. So, with that being said, before COVID-19, would you have engaged, like would you have just kissed anybody if you didn't know them? Like would you have kissed them?
I mean, it depends on how drunk I am, but I mean, no, not typically. I mean, I feel like, you know, there's a little bit in my experience of like gay culture, queer culture that, you know, when you see a friend that you automatically give them a hug, maybe a little peck on the cheek or on the lips, but I mean, I've never been one to really engage in that unless I 100% really know you.
Mm-hmm.
I'm not a real touchy-feely person anyways, I don't know if you know it or not. So if you see me touching somebody or hugging somebody, know that like I know them very, very well, I feel very comfortable with them, and it's taken a process.
Yeah, I think I agree with that. I'm not a big kisser of other people. I mean, I love kissing my husband, but friends, sometimes you have those friends who want to kiss on the lips when they first, you know, when you say hi or bye, and then outside of that, I try not to kiss anybody. Like sometimes opportunities arise. I'm like, no, not really my thing. So this would fit with that. I'd be like, COVID, I just can't kiss you right now. Especially, no offense to the friends who like to kiss on the lips, but it's not my favorite part of the day. So, and that's, I'll be adamant going forward. You know, I'm really concerned about the pandemic that could be coming, so I can't kiss you on the lips now. For the second one, it says rimming. So if you don't know what rimming is, you could Google it, but you're going to see some things that you maybe weren't prepared for. So rimming is when you lick, kiss, make out, eat on the anus. So, right, there's a few ways to say it. So for rimming, or any sexual activity that involves putting the mouth on the butt or anus, you might pass COVID-19. And the reason why is that the virus has been found in feces, which is pretty interesting that the virus can thrive for as long as it needs to ensure that it's going to reproduce and spread.
Gross.
Right?
So gross. Ew, David.
Ew,
COVID.
David. So they recommend condoms and dental dams to reduce contact with saliva and feces. So for during oral or anal sex. So Ace, have you ever used a dental dam?
No, I have not.
I haven't either. The only time I've seen a dental dam is during like my healthy sex workshops.
Yeah, I think that's the only time I've ever seen. I don't think I've even actually physically touched one.
Yeah, it's do I have? Yeah, I think I have. Right here. Let's see if I can find it.
It's a flashlight, a platform.
That's my anal demonstrator.
Oh, so this is what you would put a dental dam on.
Yeah, if you guys, you can go to the Her For Him page and scroll down, and you'll see a YouTube video of me showing you how to insert the FC2, which is an internal condom. You can use it for male or females, for vaginal, front hold, or anal sex.
Also, you have washed and sterilized these, correct?
Yeah, I'm the only one who uses it, so I'm the only one who blows this up, guys.
That's
Nobody
okay.
gets to blow it up.
I got a little frozen Germax, some antibacterial. So I'm gonna throw this on my hands real quick.
Yeah, smart. So this is a dental dam. So this is a banana flavor. These are expired, so I'm really surprised this one still has color. So that's what a dental dam looks like, as you can see. Ugh, does not smell like bananas at all. Do you want to smell it?
I'm actually gonna let you go ahead and have it. Good.
So this is like, if you'll hold up my anal demonstrator, what you'll do is you'll drape it over said anus, and then go to town. Or vagina. If you're engaging in oral sex with a penis, you want to put a condom on that. Which is why flavored condoms are a big thing, as far as like also, all of these dental dams are flavored. They come in like mint, strawberry,
Beef stroganoff.
pot pie. You
Tuna
can do
helper.
a chicken or a beef pot pie. Sometimes there's a lamb, but it's
Kiwi
super
strawberry.
rare.
Whey protein.
Ooh, I hope it's vanilla.
Yum.
They do come in vanilla. Vanilla actually is a flavor, but none of the other things that you mentioned are accurate. So that was for condoms and dental dams. The other that they recommend is only have sex or kiss if both partners are feeling well. You want to make sure you don't engage in sexual activity with anyone experiencing the symptoms of COVID-19, so that would be like a fever, cough, shortness of breath. A sex and close contact will be waiting for you both when you're better and able to engage in that practice. Right. Do you typically have sex when you're sick? Like, do you feel that urge?
Sometimes actually I do.
Yeah.
Sometimes when I'm really sick and like it's been a couple days, I'm like, God, I'm really fucking horny.
Would you say it's a cold or a flu that makes you feel that way?
Maybe both. I'm not sure. I know. I don't remember, but I know that I've been sick like a couple of times where I felt horny, and I'm like, what is wrong with me? Like I literally have only been drinking fluids. I don't really have energy, but I'm super ready to go. I don't obviously engage in sexual practices when I am sick. Number one, selfish reasons first. I want to make sure that my body recuperates and heals, but also I don't want to transmit anything to anyone else and have them go through the same ordeal that I had to go through.
Exactly. I can't remember the last time I had the flu. I've had a cold a few times, and I will agree that I do feel horny after a couple of days.
Yeah.
Sick. I don't know why
It's just
that
like
is.
lots of Gatorade, lots of Pedialyte, lots of chicken noodle soup, lots of dick, like perfect
You know, they say
solution.
D, vitamin D
Yeah.
really helps, which
For sure.
I would agree with that. I tried to get some sun the other day. I don't know if I have any color.
Oh, that's like my number one go-to. Now that I'm older, like if I start to feel sick or whatever, I'll hit a tan in bed for on high for 2
Really?
days. Yeah, and I literally like makes me feel better. I don't know if it like the vitamin D, the ultraviolet lights, or like it's just burning everything out of me. But I do feel better, and I have this amazing glow. So,
Like you freshly moisturized.
well, I did a lot of moisturizers to dress my skin, but I mean, I'm already kind of, I'm ethnic, so a little sunlight gives my skin a little refresh, a little vamp, a little glow.
So, Ace, I'm gonna pull us back on topic, guys. Sorry. So, what are some things that you're doing to maintain your health? So that could be like physical, mental health. Like, what are you doing to keep yourself safe and sane during these times?
Me personally,
Well, I mean, like,
or like what I've experienced from other people, or like what do you like for me? Like,
yeah,
what
for you
I'm-
personally, yeah.
I think that, I mean, my life hasn't, I personally don't think my life has changed a whole lot. I know that I'm a jam of Woody's and everybody sees me out like on the at nighttime and bartending and being in the crowd and things like that, but honestly I don't really have that much interaction with people outside of my job. At my roommate, and then I feel like a lot of my life is nightlife and it's here, so when I'm off on my personal downtime, I'm not usually at another bar or in large groups of people. I need my own space. I think since COVID's happened, I definitely have been kind of working. Some personal things have happened in the past couple of months, and I've had to take care of some family business. So that's been kind of a big brunt of it. Also, kind of maintaining the morale of my staff that got affected by COVID, and obviously still trying to maintain, Woody's and make sure that it's clean and fresh as we go forward. But I mean, personally, I like the fact that since I'm not around the nightlife so much now, that I have been able to kind of foster a lot of things and nurture things that I like had wanted to do in the past, but maybe never found time to, or always made excuses for, or was too tired, or was too late. I started to play guitar, learn that. It's been really fun. Learn some Spanish. I know that I should speak it by now, but I'm just now learning. I've also been able to hang out and go for walks and go do some like more organic things where I'm not on a time constraint. It's like I have 45 minutes to do this, 30 minutes to knock this out. Now it's kind of like I can let this take over my whole day. And I think it's done a lot for like, my mental health as well as my physical health, being outside, walking around, biking, listening to music, and not just the thumpa of the nightlife. And I feel like it's also given me an opportunity to connect more with friends because we're all kind of in the same boat with, extra time on our hands. So I can really have a phone conversation or a text conversation with somebody for a duration and we can talk about certain topics. This, I think, is an amazing thing that I don't think that I would have really, I guess I could have always penciled it in somewhere, but.
Right, yeah, you wouldn't have had the time to do it.
Something that I probably would have gave a lot of time to. It might have been pushed back to things that have been more important to me. So, yeah, I think it's important to spend some time for yourself. Think about the things that you want. Think about the things that are cultivating you and things that are making you shine a little bit brighter every day.
Nice. Are there, now, some people may not know about the work that Woody's is doing to help the community. So that also gives a sense of purpose maybe for some people who are stuck at home or sitting in their apartments or, feeling a little stir crazy, they want to help, they want to give back, they're not sure what to do. So there are some things that Woody's is doing in the community. What are those?
Of course. About 2 or 3 weeks ago, I was approached by Corinne Cabela. She is, to me, an amazing pillar of this community. She is with Casey Passages, which is a trans youth organization. There should be like a plastic thing on one of those tables that will hold it up. So Casey Passages is a trans youth organization. She approached me a few weeks ago. She got together with a couple of humans from Kansas City Anti-Violence Project, and they really wanted to pass out free sack lunches to people that were in need, families, queer families, the community, all this stuff. And she asked if Woody's would be willing to donate her space, which I thought that's amazing, of course. So it's actually transitioned from just passing out sack lunches every Tuesday and Thursday from 11 a.m. to 2 p.m. into, a place where people are able to drop off food pantry items, clothing, blankets, shoes, personal hygiene items, books, like little entertainment coloring things that people can not only come and get a free lunch, but they can also come and get some of the other things that they might need to donate, which at the beginning, I think that KCADP and KC Passages were funding all of it 100%, but I feel like in the past few weeks they've gotten donations from multiple people, whether it be monetarily or clothing-wise. I know that Jeff Schmitz from 303 donated a bunch of food last week, which is amazing. I know that they've hooked up with Panera Bread. They've been able to donate a bunch of pastries and baked goods. We've had people throughout the community from myriad lists of people on Facebook pages that I subscribe to, which are amazing. I'm going to give a little shout out to Stand Together KC, the Hymn Project, KC Gig Support, KC Gig Workers, KC Mutual Aid, Free Hot Soup Kansas City, Social Distancing Game Night, and Greg Razor, District 25 Missouri State Representative, has definitely really helped with a lot of questions that my staff and friends have needed about unemployment, how to file for it, what's taking so long with the whole of this. And I know a lot of people weren't able to even get past a phone call, even put on hold, and he's been instrumental in helping a lot of people. So your state representative, Greg Razor, is somebody that I definitely reach out to. Also, Karika Valley, Melissa Brown, CC Glasgow, Melissa Winter, James Moran, amazing people that are volunteered weekly upon the other volunteers that come here to help pass out food, that come here even just to help pack lunches or move boxes or sort clothes or things like that. Has been extremely helpful and extremely appreciated. So that's kind of where we are with Woody's. We do that every Tuesday, every Thursday. we're still taking donations from our buddies Venmo if people would like to donate money, or you can go directly to PayPal with KCAVP. They're accepting monetary donations. And at any time, if you guys want to reach out to me on my social media, I can go pick up or you can drop off any kind of donation that you would like to, which is great.
So donation stuff, are you talking about like clothes?
We're talking about clothes, we're talking about food, we're talking about anything, fresh fruit, produce, juice boxes, we're talking about clothing, blankets, personal hygiene items, deodorant, tampons, toothbrushes, toothpaste, shampoo, anything that you can pretty much think of. Socks.
Socks are really good.
Socks are really important. I also forgot to say that we are incorporating too with all of Tuesdays and Thursdays. We have buckets and we have a table for safer sex kits that are available and pamphlets to help with not only physical health, abuse that you may be suffering, even mental health. So we have 800 numbers, we have people that we can put you in contact with, which is readily available. I would say at any given time on those days too, not only do we have community workers and volunteers here, but there are a lot of people that are volunteering that work in specific organizations like KCAVP, KC Care Clinic, some of these big name places that are able to kind of direct you and help you to exact like places where you need to be with physical abuse or mental health or things like that.
I think it's really important that you guys are doing that for the community, but you're also bringing people together and keeping, alive the spirit of what those organizations did before COVID-19 and the impact they had. And KCAVP has had definitely an impact in the community, and their ability to keep working and to keep offering support is really important. And I think it's great that you're able to do that here and provide the space.
Yeah, I think it's awesome that they even approached me to provide a space, and I even said at the beginning, if that's the least thing I can do, like 100% I would do that. But also like not to diminish or even take light of like what these organizations are the ones that are actually doing this. KC Passages, KCAVP, and other people are like, Ace, you're doing so great, what is doing so great? Like we're basically just like the car. They're the ones that are driving, they're the ones that are changing the tires, changing the oils, pumping the gas. Like I can't even express how much, and I've known a couple of these humans for, maybe a year or two, but in this past few weeks I got to know them so much more on a personal level, and just to really see their hearts shine through all of this, and like, it definitely has impacted me and kind of opened my tunnel vision of the vacuum that I live in. So I think it's amazing, and I've really, really, really been impressed on the community around us that is upward and like really given and donated a lot of resources, which is incredible.
Yeah, I think any spot or any time that we can give back to our community or find some way to make a difference is good, especially now. You really want it. You have all this time, so you really want to do something. I think what you're doing is great. We really appreciate it. And I know from working in our exchange clinic on Thursdays for clients that are coming through, I've heard from people numerous times, because we give out toothbrushes, toothpaste, socks, whatever donated items we have, we try to give back to clients that need them. And when we're offering, sometimes we have protein bars and stuff like that, and when we offer those, this past couple of weeks, people have been like, oh, I'm going down to Woody's, they have like free sack lunches. And I just think that's awesome, because especially for our homeless population, it's not like they're following Facebook, or they're getting, live updates of what you guys are doing. So I think it's really cool that the word is spreading and that people are talking about the work you're doing. So, and that you are having an impact, like it is reaching people. So that's really important.
Thank you.
So some other things to touch back on. So I have no, do I have any comments? What is this?
Oh, there we go.
What is this?
There we go. Is there questions? Oh.
John, you will be able to watch later. We're recording this, so I'm going to edit it and then do some little clips and answer some questions.
Oh,
That's how you do it.
We miss you, girl. I love you so much. Hey, Brandon Wilcox.
Hi, Korea.
Hey, Korea. I love you. You're incredible. Melissa Brown, my heart. I love you so much. Oh my gosh, Cornell. Cornell, I miss you. I love you. You're amazing. I'm still gonna punch you in the face.
Yeah, you guys have been having it out, but that's okay.
Hi Paisley, hi Ryan, hi Eric Ireland, hi Michelle, hey Terry O'Neill, hey Trevor, hey Jamie, Emily, it's been a while, I miss you as well. Brett Cheyenne. Hey, for the people who are not, how does this look?
There you go.
Does PrEP protect you from all STDs and infections?
Felicia, great question. So it's really important to know that PrEP, pre-exposure prophylaxis, protects you from contracting HIV. It does not protect you from any of these other STIs. So you have like little squiggly, like a snake or a worm, is syphilis.
Gonorrhea,
Oh my gosh, that one's really popular.
crabs,
Don't see that one often.
chlamydia.
What is it? Oh, trichinosis. Yes. Look at that. Look, she's just tossing that hair.
Hepatitis.
What's this little black one? Oh, this is HIV.
Ooh.
He's wearing a ribbon.
There we go.
Oh, and herpes. You know, they wouldn't make it look like a sun. So all of these, except for, well, actually, all these are treatable. Some are curable, some are manageable, like herpes you live with, HIV you live with, syphilis you always test positive for. They just check your RPR and you talk to your doctor about what that means. Does she have, what was it?
Yeah.
So, if you are concerned that you may have an STD, it's really important to get tested. So right now, you may be worried about like where can you go to get tested? How can I access those services? Are they still open? Are they still doing something like that? So at KC Care, we are still offering HIV, Hep C, and syphilis tests. Those you can have done for free. It's on a walk-in basis. Monday and Wednesday is from 2 to 6 p.m. And then on Fridays it's from 2 to 5 p.m. So again, at KC Care, you can get an HIV, a Hep C, and a syphilis test for free. Monday and Wednesday, 2 to 6, and on Friday from 2 to 5. You can also do the full gambit of HIV, herpes, gonorrhea, chlamydia, syphilis, trich. I think that's all of them. I have a long list sheet over here. You can get all those done at the Kansas City Health Department. You just want to make sure you check their website, give them a call, see if you need to make an appointment or not. Outside of that, Thrive Health Connect is not open at this time, so you will not be able to access services there. But you can always go to their Facebook page and just to keep track of like when they are going to be offering services, when they will be opening back up. That was a really good question. Thanks, Felicia.
Yeah, and we are open, not to the public, but we'll be open from 11 until 2 on Tuesdays and Thursdays for free stack lunches. We are running out curbside. Nobody is allowed actually inside the building except for volunteers, where they are, social distancing, masks, gloves, all that. But we do still have safer sex kits if you need to stop by, grab some condoms, grab some balloons. I think maybe Wes might have thrown in some dental dams in some of these, but we're a place where you can come and get those for free as well.
Yeah. So I want to thank Ace for being a part of this, Woody's for helping and providing the space for us to do this. I want to thank everybody who's watching. Like, we appreciate you being a part of this. Make sure you like the page, share the page, follow us, and that goes for Woody's KC as well. Like, they have a new logo. I don't know if you can see it, which I didn't know that they had a new logo, so that's really cool. You can also, let's see, follow KC Care. That's KC Care Clinic or Health Center now on Facebook. I don't know if we have Instagram or not. Ace, do you have any last words, like suggestions on how people can help or what recommendations you may have?
Yeah, I think just reaching out to your local organizations. I know there are maybe a few of them that I follow, just groups on Facebook that people are always needing stuff. I encourage us to take care of one another, take care of each other, really support local. I think Kansas City's really been branded on that. I do want to thank everybody that has been helping with volunteer and donations over the past couple of weeks. If you do want to donate monetarily, you can always donate to the PayPal for KCAVP, or you can go to Venmo and donate to Woody's-KC. We are accepting monetarily donations. We will fund the organizations that are helping us as well. Also, we are a place where you can grab safer sex kits. Thanks for having me. I appreciate it. I can't wait to see everybody once we reopen and throw our first couple of big parties.
Oh my gosh. Yeah.
So excited.
Yeah, edge of my seat here. I haven't been to a party in so long. Ooh. So I'll add that if you do need safer sex kits, if the places you typically would go to get one are closed, you can visit the I Got Mine. If they have a sticker or you see this orange box, that means that they typically will have condoms in stock. You can call just to check to make sure the place is open. I know the health department, you can get condoms there. You can still get condoms, safer sex kits at KC Care, and on Tuesdays and Thursdays you can pick them up here at Woody's from 11 to 2. Ace, I want to thank you. I want to thank everybody who has helped out to make this possible, and wish everybody a good Wednesday. Happy hump day. Stay safe.